Now let's talk about your medical insurance options. In this segment, we'll discuss the Classic Plan, the Premier Plan, and the Health Savings Account. Everyone must be enrolled in a health insurance plan, per the Affordable Care Act, the individual mandate. Your options are enroll in the UA Medical Insurance Plan, or remain enrolled in your current plan, perhaps through your parent or spouse, Medicaid, or Medicare. Enroll in other coverage. Keep in mind that if you are eligible to be in the UAMS plan, you likely won't be eligible for a government subsidy to pay for the premiums through the marketplace. Also, the marketplace may not be having open enrollment at this time. There are 3 plans offered. All are officially called the University of Arkansas Health Plans because we're self-funded and self-insured. The university contracts with these vendors to process claims according to our plan. Medical benefits are processed through UMR, and prescription benefits are processed through MedImpact. Please refer to the current rate sheet for premiums. You choose your medical plan. The 3 plans are shown here. Please refer to the University of Arkansas at-a-glance medical plan options to compare the plans. For your information, Classic is the primary default plan. So once you've selected one of the 3 plans, you're not locked into that plan forever. Annual open election is held near the end of each year for you to change to the other plan effective January 1st. But this only applies to employees who are already enrolled in medical. While annual open enrollment to add family members or for employees to enroll for the first time may be offered in the future, it is not guaranteed. You may be asking, what's the same in all 3 plans? Well, medical claims are processed by UMR and prescription claims are processed by MedImpact. Preventative care is covered 100% if you go in network, and ancillary services provided by UMR and the university include disease management discounts including diabetes, healthy heart, tobacco cessation, and maternity. There's also a 24-hour nurse line. We also have the same national provider network. You pay nothing for any of the preventative care services shown here when you go in network. In-network includes a doctor, hospital, or other healthcare provider listed in the network by UMR. The network is nationwide. The following is a list of local hospitals that are in network, and they include UAMS, St. Vincent, Arkansas Children's, Baptist, and the Heart Hospital. If you're searching for an in-network provider, you can visit the UMR website shown here. Note that there is a different link to locate a provider outside of Arkansas. You can also visit the HR homepage, where there will be a quick link to our medical insurance page, then a quick link for UMR provider search. By now you're probably asking, what's the difference in the plans? The Classic is the default middle range plan. It's open to everyone. You must go in network for all care. The exception is for emergencies or for medical services that are not available in network, and UMR has authorized in advance for you to go out of network. The Premier Plan is the Gold Plan. It's open to everyone. It offers the lowest out-of-pocket expense at the doctor, hospital, and simpler benefits, but it has a higher premium cost. Out-of-network benefits are available, but out-of-pocket costs will be greater. The Health Savings Plan. The Health Savings Plan has a high deductible and is consumer driven. You must be under age 65 and have no other coverage. It has the highest out-of-pocket expense at the doctor, but lower premium cost. You pay all expenses through your health savings account or out of your pocket until you reach the deductible. Out-of-network benefits are available, but out-of-pocket costs will be greater. All 3 plans offer an incentive discount for coming to UAMS for your health care, called SmartCare. You don't have to sign up for SmartCare. Savings are automatically applied simply by coming to UAMS. SmartCare is available to employees at all University of Arkansas campuses and to their families if you are covered under a UA medical plan. SmartCare provides a concierge service for employees. You can make your first appointment at UAMS by simply emailing your request to smartcare@uams.edu, or you can call them at 501-686-8749. This is a dedicated telephone number just for UAMS employees. There's also a SmartCare video available for you to watch. You may access the link you see here by clicking on the link available at the top of this form. If you're new to the area or have never had medical coverage before, you should consider using the providers here at UAMS and in SmartCare. For example, all UAMS doctors and clinics are in network under our health insurance. Many, but not all, are also part of SmartCare. If you're looking for a PCP, a primary care physician, check out the UAMS Family Medicine Clinic or the Internal Medicine or Geriatric Clinic. All are under SmartCare. You can also go to Find a Doc at www.uamshealth.com. On this slide you see two lists. The list on the left includes all SmartCare facilities. The list on the right are facilities that are not in SmartCare. It is important for you to understand how our medical coverage works. For example, when you go in network for care, some things are covered in full by insurance. Some things are subject to a copay, while some things are subject to a deductible and coinsurance. Your copay is a fixed amount, $20 for example. You pay for a covered health care service, usually when you receive the service. The amount can vary by the type of covered health care service. For example, you pay a copay for a doctor's office visit. Labs, x-rays, and other in-office procedures are subject to a deductible and coinsurance unless in conjunction with a preventive care visit, for example, your annual physical. You also pay a copay for most prescription drugs in the Classic and Premier plans. The deductible and coinsurance. The deductible equals the amount you pay up front each year on medical services before insurance pays. This is 2 times the single deductible if you're covering your family. Coinsurance equals a percentage of the bill you pay after you satisfy your deductible. You pay a percent, 25% in network for example, and the insurance pays a percent, 75% for example. The annual out-of-pocket maximum gives you financial protection, a safety net. Once you reach your out-of-pocket max, you stop paying for covered services for the rest of the year. You keep getting your covered medical and hospital services as usual, and the plan will pay full cost. The Classic and Premier plans. New employees enrollees are defaulted into the lower wellness out-of-pocket maximum in their first calendar year of coverage. Later, you will have an opportunity to participate in the Wellness Incentive Program to maintain the wellness reward in future years. The medical out-of-pocket max applies to copays, annual deductible, and coinsurance. A separate pharmacy out-of-pocket max applies to prescriptions covered under the formulary. Health savings. The out-of-pocket max applies to annual deductible and coinsurance on both medical and prescription costs. No separate out-of-pocket max for prescriptions. This is how the Classic plan works. You pay copays for doctor and specialist visits. You also pay a copay for certain other expenses and prescription drugs. You pay coinsurance, that is a percent of the bill, for diagnostic labs and doctor's office visit. You pay all other expenses in full until you meet your deductible. Once you meet your deductible, you and the university share the cost of the covered services through coinsurance. If you reach the medical out-of-pocket maximum, the plan pays 100% of all eligible expenses for the rest of the calendar year. You must use in-network doctors and providers. Benefits are not paid for services outside the network, except in emergencies. You pay a $15, $55, or $90 copay for prescription drugs covered under the formulary. The Premier plan is similar to the Classic plan. However, you'll pay the least out of pocket. You pay copays for doctor and specialist visits, inpatient hospital admission, certain other expenses, and prescription drugs. You pay all other expenses in full until you meet your deductible. Once you meet your deductible, you and the university share the cost of covered services through co-insurance. If you reach the medical out-of-pocket maximum, the plan pays 100% of all eligible expenses for the rest of the calendar year. You have the option to see an out-of-network provider. However, you will pay more for your care. You pay a $10, $50, or $80 copay for prescription drugs covered under the formulary. If you're considering the Premier plan, calculate what the higher premiums would cost you annually, particularly in comparison to the Classic plan. Then estimate if the richer benefits would make the higher premium worthwhile. This may be a good option if you anticipate being admitted to the hospital, for example, pregnancy or a knee or hip replacement. You see a doctor frequently and are on expensive medications. Or if you're willing to pay more each month, the premium, for the peace of mind and knowing how much you'll pay when you visit the doctor or are admitted into the hospital. The Health Savings Plan is a qualified, high-deductible, consumer-driven plan, as defined by the IRS, paired with a health savings account, which you can fund with pre-tax dollars through a payroll deduction. The university may also contribute. Until you meet the deductible, you pay for all medical care and prescription drugs from your HSA or out of your pocket. The deductible is $2,700 for individuals and $5,400 for families. You must commit to funding your HSA so that you can cover your deductible and other medical costs in the future. Once you meet your deductible, you and the university share the cost of covered services through co-insurance. If you reach the medical out-of-pocket maximum, the plan pays 100% of all eligible expenses for the rest of the calendar year. You have the option to see an out-of-network provider. However, you will pay more for your care. If you enroll in the Health Savings Plan, you are eligible to open a health savings account. Your HSA will be set up at Optum Bank. An HSA is similar to a checking account. Once money is deposited, it's available for you to spend on eligible medical, dental, and vision expenses. Please note that you are held responsible by the IRS for spending HSA funds only on qualified expenses, else subject to taxes plus a 20% penalty. But there is no use it or lose it like a flexible spending account. More on FSAs later. If you already have an HSA through another bank, you can transfer it or roll it over to Optum Bank. To fund your HSA, set up a pre-tax payroll deduction. You can change your amount at any time. At least put your premium savings here. Or fully fund up to the IRS limit of $3,450 for a single or $6,900 for a family. The limit includes the university's contributions. In 2018, the university will contribute $420 for single, $840 for family to your HSA, which is prorated if you enroll mid-year. An additional amount may be added if you participate in the next wellness window. University contributions are not guaranteed in future years. You or others can make deposits with after-tax dollars and may claim tax savings when you file your tax returns. Optum Bank monitors the limit. The HSA may be a good option if you're healthy and you rarely get sick or injured. You're not on expensive medications and you can afford to pay the $2,700 for single, $5,400 family deductible up front if an unexpected medical expense comes up, perhaps because you had this type of plan at your previous employer and already have HSA savings. The HSA may be a bad option if you have a chronic condition and need to see the doctor frequently. You are pregnant or planning to have surgery. you have small children, you or your children play sports, especially those with high risk of injury, or if you don't have the budget to pay the full price of a medical bill or prescription out of pocket. The next 3 slides show what you'd pay for a specialist doctor office visit, a hospital stay, and maternity. Please refer to the University of Arkansas At a Glance Medical Plan Options for additional examples. This slide provides you with comparison examples of what you would pay for a specialist visit based on the coverage of the 3 plans if you go in network versus SmartCare. This slide provides you with comparison examples of what you would pay for a hospital stay based on the coverage of the 3 plans if you go in network versus SmartCare. Your cost to have a baby is the same as a hospital stay. Hospital inpatient costs apply at delivery. You pay nothing for covered prenatal care and physician delivery charges. Be sure to add the newborn through Human Resources within 1 month of birth. Don't wait for the Social Security number. And here's a tip. Reduce your cost by $300 by enrolling in the UMR Maternity Management Program in your first trimester. Please call 1-866-494-4502 or refer to the brochure found on our website. While traveling, you are covered anywhere in the world for sudden onset of unforeseen illness or accident. However, UAMS SmartCare savings do not apply. You can lower your costs by going to an in-network provider. You must notify UMR within 24 hours if you are admitted to any non-participating hospital. If possible, use network hospitals for emergency services. For Classic and Premier plans, emergency room copay is waived if you are admitted. If not admitted, pay $150 for the first visit, $200 for the second, $250 for the third and future visits in a calendar year. The $100 ambulance copay is waived if you are admitted. Health savings. You pay the entire cost until the $2,700 deductible is met. Out-of-network benefits under Premier and Health Savings. You have a separate deductible to satisfy. $2,000 for the Premier plan and $2,700 for Health Savings, 2 times for family. This is an additional deductible from the in-network deductible. Then insurance covers 50% based on maximum allowable charges. You pay other 50% co-insurance. Separate out-of-pocket maximum, $9,000 for the Premier and $9,700 for the Health Savings, 2 times for family. Your out-of-network doctor may balance bill you the amount over UMR's fee schedule. Your actual costs may be 50% plus the difference between actual and allowable expenses. Regardless of the plan you choose, make sure your current PCP is in network, or if you don't have a PCP, select one. Your PCP is the best place to start when you need any type of health care. It's okay for each family member to have a different PCP. If your PCP refers you to another doctor in the network, no UMR referral approval is necessary. When in doubt as to your coverage or plan benefits, contact UMR at the number toll-free shown here or log in to their website. Looking for more ways to save money? Check out these unique health management programs. OnLife Health is a free health and wellness program for employees and spouses insured under a UA medical plan. Participation may be required in order to receive enhanced medical insurance benefits next year. New employees will be defaulted to the wellness reward their first year, but you must participate in the next wellness window, usually July through September, to receive the reward in future years. During the announced wellness window, you will need to get your numbers at a biometric screening and log in to OnLife and complete a health risk assessment. Still looking for other ways to cut your medical costs? Take an active role in maintaining your health. It's good for you and good for your wallet. Take advantage of preventative measures like annual physicals and cancer screenings. Starting a care regimen early for potential issues will save you money in the long run. Quit smoking or using tobacco products. Starting in 2019, tobacco users will pay an additional $50 per month premium in all 3 medical plans. Prescription drug benefits. If you participate in the Classic or Premier plan, you will pay a copay for each 30-day supply of prescriptions. If you participate in the Health Savings Plan, you will pay all of the cost of your prescriptions until you satisfy your deductible. Then you will pay 10% co-insurance. Log into MedImpact's website to do a price check on your prescriptions ahead of time, or refer to the UA drug formulary posted on our website for a list of commonly prescribed drugs that are covered. Please note that some drugs are subject to quantity limits, step therapy, prior authorization, or reference-based pricing. Show the formulary to your physician when drugs are prescribed to see if a less expensive generic drug is available. While most pharmacies in Arkansas are included in the MedImpact network, consider our very own pharmacy. The UAMS Outpatient Pharmacy is conveniently located on campus on the first floor of the UAMS Outpatient Center. $4 medications for many generic prescriptions are available. The $4 list is posted on the UAMS Intranet. Or call the pharmacy at the number you see here. Delivery service is available on campus. Get your refills without leaving the office. There's also a payroll deduction available. UMR will send you medical cards with your unique member ID number. One card. Show it to both your doctor and your pharmacist. All covered family members will be listed on each card. For more information, check out UMR's website at the link shown here. After registering as a member, you can check the status of claims, print an explanation of benefits, order new ID cards, or print temporary cards, view a description of your benefit plan, and other great health resources.